But our next guest, I want to bring in Republican Congressman Andy Highrisk because, first of all, he's a physician. He's also a member of the Appropriations Committee, and he joins us now by phone. Representative Highrisk, thanks for joining us.
My pleasure.
Have you heard, do you know the bones and the outlines of this new proposal so far?
Well, I don't think it's going to change much from the old proposal. I mean, the basic concepts are the same. We're going to make sure that people with pre-existing conditions have a way to get covered, and we're going to make sure that all the features that people like of the Affordable Care Act, that we retain them. The features people don't like, we're going to eliminate.
And how do you pay for it all? Because it sounds magical.
Well, you know, if we bring down the cost of health care, which I think we all have to admit the Affordable Care Act did not do, if we bring down the cost of health care and health care insurance, then, of course, it will cost much less to insure the same number of people than under the Affordable Care Act. We'll use a different method. We won't use individual mandates. We'll use high-risk pools in all likelihood, and we will, in essence, that's our way of bringing down the premiums. And we hope that, again, states have will have much more leeway in developing exactly the product that works in that state, and think it's going to be more economical.
Yeah, well, that's beautiful. The one-size-fits-all, obviously, New York State and Wyoming it has been something of a catastrophe. I want to ask you about those high-risk pools, the suitability fund for those high-risk pools. How exactly does that work?
Well, you know, the vast majority of states had high-risk pools before the Affordable Care Act. I'm from Maryland. We had one. It worked very well. You know, the premiums were subsidized from a small tax on all hospitalizations. So what we hope to do is to encourage states to set up these high-risk pools. We will help them fund them, and hopefully over time, the federal share will go down, the state share will go up. So it'll mimic what happened in Maryland before the Affordable Care Act, which is basically the state took care of covering its high-risk pool on its own.
You mentioned the states. I got to bring up Medicaid. I know a lot of Republican governors anxious about this one. Of course, they got deeper involved with the Obamacare, sort of taking the bait when a lot of people warned them not to. Nevertheless, it is what it is, and they're concerned. They're concerned, and apparently there's going to be a freeze and a grandfathering in of existing Medicaid patients. Is that going to be good enough?
Well, I hope so. I mean, the promise is that no one who has it now will lose it. Certainly, if they become ineligible for Medicaid, then they would drop off the Medicaid rolls because their income went up. But in essence, what we're going to do is, again, we're going to turn over a lot of these to the states, a lot of the control to the states. I think it's easier to control the waste, fraud, and abuse in the states. We know that it's probably 20 to 25% of Medicaid budget is waste, fraud, and abuse.
Right.
The Medicaid expansion added about $125 billion at this point to the federal deficit. So the federal government can't afford it. I mean, very simply put, we've got to get this all transferred into the states. We've got to go back to the same match that the states had for the pre-ACA Medicaid population, and then trust that states will develop individualized plans within their states that deliver the product at a lower cost with less waste, fraud, and abuse.